How did you ensure patient safety during the COVID pandemic?
Patient safety during that pandemic, as at all times, is a fundamental of good patient care and leads to good patient outcomes. Oncology teams across the NHS were instrumental in implementing changes both to clinical and operational services. The core driver of both of these changes would limit patient exposure and therefore the risk of COVID-19 to patients, whilst ensuring that all governance arrangements were continued appropriately. So from an operational changes perspective, we were looking to minimise the time that the patient stayed in hospital. We had widespread expansion of the home care services that are already quite commonly used within the NHS, including IV and oral services, which was facilitated by the National Medicines Home Care Committee. They specifically prioritised oncology services as being high priority for the additional capacity in any of the home care services that there was. Some trusts utilised courier services to be able to deliver medicines to their patients. And we ourselves at Velindre set up a drive-through service where patients could come and collect their medicines without having to leave their car, and were handed the medicines that way. So there was a lot of operational services changes there, those being some of them. Then from a clinical services perspective, we did things along the lines of we switched some of the treatments from IV treatments to oral treatments. So for an example, we switched to the use of tyrosine kinase inhibitors as a first-line treatment in the renal and melanoma settings. And then we also did things like switching to less frequent administration, so changing from a standard, what we normally see as a 3-weekly administration, so patients come every 3 weeks. We changed some of the dosing and the administration to double dosing, but less frequent administrations. So one example of this is devolumab that we commonly use within lung cancer. Normally it's on a 2-weekly administration schedule, which is quite intense for patients, and obviously would mean that they'd have to come to the hospital twice a month for that. We, from taking advice from NICE, we went to an off-label dosing where we went to 4 weekly administrations, and we doubled the dose there, meaning that the patients had to come to hospital one less visit per month then. And there were other examples of extending that administration schedule, particularly in the immunotherapy area.
How did you deal with patient education and patients' questions about drug treatment?
Well, one of the obvious concerns with utilising things like home care, couriers and drive-through is that it removes that traditional touch point that pharmacy professionals have with their patients when handing out the medicines and doing the counselling. So we identified quite an early point that we needed an alternative mechanism to be able for patients to access medicines counselling and, as you said, drug questions as well. So we built on our current traditional education service that we have, which is pharmacy technician-led here at Velindre, and moved to a virtual model where we offered patients counselling either via telephone or a video consultation in order for patients to still be able to receive that same level of counselling that we would have provided them earlier. The service was also provided on an ad hoc basis, so patients could, even if they'd had counselling previously but had some questions about their drug treatment, they could access that service ad hocly through the digital platform that we've got. And similarly, our non-medical prescribers as well, when they undertake the reviews and also the patient counselling as well with medication, we moved to a virtual model using telephone and video consultation. And we also utilised our platform allows for a virtual waiting room where patients can come and sit ad hocly and then be admitted when we've got time available to see them as well. So all those work really well. We've got a lot of good feedback from patients. Very positive, I think, there.